So what else can what other kind of questions do you have, Charlie?
Well, I'm kind of, learning to be an
Sure.
advocate and learning
Yeah.
to ask, as we've been going through this, you start figuring out like, oh, I have to be, a couple days or a week ahead of time for some things because you have to make decisions sometimes,
Yep.
very quickly, or, potentially they come up to you and go, your mom's being discharged in 2 days.
Yep.
So we try to prepare ourselves for what's coming next.
Yeah, I think you're encapsulating a lot of the challenges of becoming a new care partner. I think, and that role goes often underappreciated, and I think it is a challenging one because it's not simply you're supporting that individual, but you're also managing a lot of the logistics and stuff too. So yeah, it is a learning process, and I imagine it is a lifelong learning process.
Yeah.
So I think. Yes, so it's a challenging situation. But I will say this, do not think of this as your last opportunity to ask questions. I'm not,
Okay.
this is not an exhaustive thing. So you
Yes,
are always welcome to come back on.
thank
You're
you.
also
I'm just kind of learning things, so I don't
Sure.
have terribly detailed questions at the moment.
Sure. That's totally fine, Charlie. I think, you're always welcome to come back on. I would very much encourage you to jump on to the support group. There's a lot of care partners there who can, it's a really positive group in terms of not only the individuals themselves who are survivors, but also their care partners are there. And there's some really great transmission of information about kind of, and it's a really open and welcoming environment. So feel free to ask questions too.
Great. Thank you, Doctor.
Yeah, of course, of course. I'm really glad to have you here. So I guess what I'm going to do now, Charlie, is I'm just going to go over quickly to Dr. Steve Wolf, and I might get his thoughts on our quick conversation.
Okay.
And you're welcome to stick around. And if you have any sort of follow-up questions, just let me know.
Great. Thank you.
Of course. Okay. Well, Dr. Wolf, as always, it is such a pleasure to have you here on the Rehab Power Hour. Welcome.
Great to be here, of course, and thank you, Charlie, for sharing your story with your mom and your incredible dedication to her rehabilitation. I wish I could say from my experience, at least, that is typical, but regrettably, often it is not. And many hats off to you. And I'm sure that the Motus folks and others, if they can provide any advice to you regarding their products or opportunities for your mom's rehabilitation, as one understands her progression more clearly, I'm sure that they'd be more than happy to do that for you.
Appreciate your kind words.
Yeah, and I think, and Dr. Wolf, exactly right. We're here to support you guys, and if that means using one of the systems, great. If it doesn't, that's fine too. We are all here to help support the community in whatever way, shape, or form we can. So, just wanted to reiterate that. Well, Dr. Wolf, any kind of thoughts except on that concept of that transition period? I know we kind of mentioned this, that transition period from subacute to the outpatient. I know we've talked about this several times before, and it's a steep drop off there. And that's, go ahead, yeah.
There are lots of concerns that will be floating through your mind over the course of the next several weeks, especially. I'm still not exactly sure if, I think I heard you say that when your mom was taken off medication after sustaining a fall that might presumably have been related to that medication, she sustained a second stroke. Is that correct?
Yeah, I think Charlie is muted right now.
Okay. Well, I will presume that he can hear me and that that was correct.
Yeah.
So what's coming up for your mom, in order to be eligible for fairly intensive rehabilitation, she has to be able to sustain up to 3 hours of rehab a day in any combination of speech, occupational therapy, and physical therapy. And only you and the therapists who work with her can make that decision. I would encourage you to advocate lobby, whatever the appropriate term is, for that to become a reality. And that's a very slippery slope because, as you may know, while most rehab facilities would welcome the opportunity of working with a client, with a patient intensely in a rehab environment, the patients have to adhere to the so-called 3-hour rule. And that's because Medicare and other payers have agents that observe, sometimes clandestinely, the operations of rehab facilities to assure that they're not taking people in who don't qualify for those, under those rules and regulations, because they could lose their license to seek to treat patients. So that's something to be kept in mind as you talk throughout the acute rehab phase with the therapists who are working with your mom. So trying their best to be able to have a case manager usually make the decision about your mom's next steps in her rehabilitation process and her eligibility for rehabilitation. I'm just trying to set this straight for you. So that's the next big consideration that needs to be made, because based upon those decisions, her rehab course and the environment in which that can be done and what can be afforded to her in terms of quality rehab, whether it's in a home environment, a longer-term care facility, or a rehab environment, is determined by those decisions. And undoubtedly, from what I've heard thus far, you want to play a critical role in how that progresses and moves forward. Now, that's even not knowing very much accurately about your mom's current status right now. I'm just kind of laying out the structure of the considerations that will be going on in the next several days, if not weeks, in terms of eligibility and what's best for your mom and what therapy she should be having, and the extent to which the really nice equipment that Motus Nova has can benefit your mom and progress her along. Really requires on the part of Dr. Halsey and others a lot more knowledge about your mom's status right now.
Yes.
So I'm not trying to overload you. I just want to present to you what, from my experience, which is pretty extensive, what the thought processes are that will be occurring over the course of the next several weeks as your mom is monitored for her progress and what decisions can and should be made for her future rehab.
Yeah, and thanks for that, Dr. Wolf. I think it's we very much understand that it's a lot to take in, and so that's one of the reasons why I say do not feel pressured to have all your questions right now. So we're here to support you, and feel free to engage with us when you think is best, and we'll be here when you need us.
Thanks.
So yeah, of course. Well, Dr. Wolf, I think there were a couple of really cool questions that this is a great conversation, though. I really appreciate this. And so I think there's a couple of follow-up questions from our last session. And just to remind you guys, last Monday, we were chatting about sort of this idea of how much rehab, when do we know we've kind of hit enough rehab? And there were some really nice conversations in the support group about some sort of follow-up things. And, we talked about sort of the sensations of fatigue and how to mitigate that. But then someone rightfully pointed out, well, what happens if I don't have any sensation? If I don't have the ability to feel that fatigue, for instance. And so that kind of brought on some discussions about, well, what's the role of sensory feedback as it relates to motor learning, more specifically motor learning following neurologic injury. And I was able to provide a little bit of context to that and sort of the importance of biofeedback as a surrogate for that sensory information, which is normally gathered. But I wanted to kind of get Dr. Wolf's opinion about this, get his some discussion with him about what's the role of sensation and what's the role of sensory feedback in the process of neuro recovery.
Well, I think any of us, to start this out with a point of reference, I think any of us who've ever carried groceries, as an example, for any length of time, know that our arms get tired. And if we put the groceries down, our elbow joints often feel a little strange. You know, we just don't have the control of the movement that we had before because the activity of these sensors in our muscles has been stressed to a large extent by having to carry this load for a period of time. And so we feel it takes a while for us to appreciate how long or how short of these muscles called the biceps, the ones that bend your elbow, really feel. And that's just a simple example of the importance of feedback from our muscles about what the length of those muscles are and our ability to control or regain control of them. So with that being said, can we imagine how difficult it is for one of our loved ones who says, I'm not exactly sure what I can feel and what I can't feel, to try to regain or reacquire control of their movements, because there is this very strong loop between sensation and how those inputs from our skin, from our joints, from our muscles influence the movement of those muscles and our control over them. The worst case situation is when someone has no appreciation of movement at all. So what do I mean by that? There are two ways in which we can see that, whether we're clinicians or care partners. Our loved one may have no sensation or feeling in their skin at all. They can't tell you where light touch is or deep pressure, which tells us some of the sensory inputs, which is so important in trying to regain movement, may be severely compromised. But even more important and more severely detrimental is if our family member or loved one cannot even appreciate joint space. If you move the joint where it is, they have no feeling for what that motion is. And that's very difficult. The potential value added from the feedback that Dr. Housley was referring to is that the visualizations that we see, whether it's a line moving up or down on the screen, which indicates how much muscle activity you have, or how much joint movement you have, or a change in a game, succeeding or failing in the game, and how you, the patient, can relate those changes to what their muscles are trying to do, is the difference between the potential to reacquire this feeling of movement and knowing where joints or muscles are in true movement. Because we need to have that in order to successfully manipulate, control, move our limb in a functional way, whether it's trying to hold on to something or putting our arm through the sleeve of a shirt. All those factors are important in the control and reacquisition of successful movement. So what the feedback kind of opportunities do is give the patient a clue as to what the relationship is between movement and function and their awareness of that. So in the case that Dr. Housley presented, one of the cues that might give us some insight as to whether this kind of training is helping is if the patient now has a better sense, since we do a lot of work here at the wrist and the hand, where that is, they're trying to do a task, whether it's attempting to grasp an object or just get an arm up through a sleeve, being aware of where the joint is and how you can succeed doing that better, or it seems easier is the phrase that patients often use, and how that relates to the training, the gaming, the interface that Motus or other tools provide, and information we normally can't appreciate and understand that easily, especially after we've had a stroke. So all of these pieces kind of come together to reacquire movement. And when a patient says, hopefully, it's easier for me to do something than it was before I had the training, I'd like to think what they mean is, I've kind of gained a bit more sense here of how to control these joints when I'm trying to do something. And hopefully that's been done through the therapist's training and the interface of the gaming and other feedback provided by equipment such as the mentor systems that Motus has. I don't know if I'm exact. I'm trying to keep this very simple so that those listening can have an appreciation for what a patient is trying to reacquire. Because often patients can't express themselves as clearly as we would like to, and we have to interpret what someone's saying as how it relates to some kind of reappreciation of their sensation and then their ability to gain control of movement, especially in those muscles that are length detectors. They tell us how long or short our muscles are, which is essential to being able to move correctly, move a joint across which those muscles and their tendons pass successfully.